how can I decide what are the right kind of patients for me? What's the right practice for me?
Well, I think just like with anything in life, first you need to sit down and ask yourself those important questions. For example, what you just said. Well, how do I know? Well, first you need to do a little research, right? You need to understand. Okay, well, this is an HMO practice, and my office is not full, just all HMO. But I'm just saying, okay, if this is the HMO model, how do you make money? If this is the PPO model, how do you make money? If this is Denical, how do you make money, right? And then you need to know things like how much does it cost to run a practice. Um, get in other words, before you decide, let's say if you're graduating from dental school or you're thinking about buying a practice, before you decide, you know what, I just want to practice 1 mile from home, and I'm only going to work 3 days a week, and whatever it is that the ideal practice may be for that person, make sure you understand the numbers that go along with it, right? So I'll give you I'll give you an example. Let's say somebody say, I only want to do 5 Invisalign cases a day, right? And let's say it's $5,000 each, right? So okay, so for today, I have a potential of earning 25,000, right? But you're seeing that patient for a period of 12 to 24 months. The 25,000, it doesn't come, or you may collect upfront, but I mean the work that is done is going to take 12 to 24 months. I may say, you know what, I'll do 20 crowns or 25 crowns. So it's the same production, but who said that I have to be the one doing all 25 crowns? I could put in an associate. So I'll do 5 crowns and you do 5 crowns. So to understand that dynamics, that there's more than one way to get to that production. And do you have to be the one doing that or not? That's the other part where people get frustrated. Like they said, for example, people say, okay, endo has low overhead, which is very, very true, right? So let's go do endo. Let's do a lot of endo. Let's go take courses and do endo. Personally, for me, like I mentioned before, I don't like sitting for a long time. I'm perfectly fine jumping from chair to chair. So if you tell me, oh, all you need to do is just do 4 or 5 endos and you have let's say $6,000, $7,000 a day, but it's going to stress the heck out of me. so I'm not doing that. I'm not doing that route. So I think a lot of time to decide what you want, you actually need to first understand who you are. What I mean is to decide what you want to do, you need to know what you want first.
What do you think goes into that? I know everyone defines success a little bit differently, but I think everyone in some ways, like, I want to be successful. So what are some of the elements of that?
Well, I think a prosperous practice or profitable practice, obviously you need to control your overhead. You need to understand where to invest your money. I'm one of the person who totally support back into the practice.